Hello, I'm Dr. Marla Shapiro, and I sit on the Board of Trustees at the International Menopause Society. And today I'm joined by Dr. Ludwig Kiesel. Could you please introduce yourself to everyone who's listening to us?
Yeah, my name is Ludwig Kiesel. I'm at the Department of Obstetrics and Gynecology in Münster, and I'm a professor of gynecology with interest in menopause and endometriosis.
So let's talk about endometriosis. For women who have endometriosis, they've become aware of what it is, but for many women, they're unaware of what endometriosis is. So, as difficult as it is to try and explain it, what is it?
Yeah, that's really the case because most doctors and patients will think of endometriosis just before menopause,
Right.
but this can keep on and stay there. But once there is no cycle, then women can't relate their pain to cycle, so it will be very difficult to distinguish from other pains. So the diagnosis is after menopause rather difficult.
Right. But it can happen after menopause.
Yeah, there's about maybe 2 to 3%. So it's low. The risk is low, but there is some women, and I believe that these problems are not easily found. So I think it's quite underdiagnosed. So
Hmm.
most women may actually not be diagnosed of endometriosis, but doctors think of just general pain.
So, if I'm a woman with endometriosis, do I run the risk of being younger than my friends who don't have endometriosis and menopause?
Yeah, the problem with menopause in those women is due to the loss of the ovaries, which may be operated on. So, in women who have endometriosis, they have often endometriosis in their ovaries, and if you operate several times, then you may lose some ovarian substance or even the entire ovary, and then you have no hormonal function, and these women will come into menopause much earlier than other women.
Now, is it possible to treat these women with endometriosis? And is it different if they've had a hysterectomy and lost their uterus? Do they get treated the same? Do they get treated differently?
Yeah, they do get treated differently, and because we don't want to enhance the growth of these potential endometriosis, which is still there and just not recognized. So, if you would treat these women just with one hormone, which is the estrogen, then the growth would be enhanced and potentially. So, what we have to do in these women, even in those women who don't have the uterus, we have to add these other substance called progesterone or progestins in order to block endometriosis. So all women who have endometriosis in their history should have not just estrogens, but also progesterone.
So, is there an increased risk for women with endometriosis of having different types of cancer? Does this predispose them to malignancies?
Yeah, we believe, and there are several studies who show that there is an increase of some of the cancers, and the main one being ovarian cancer, um, possibly because it's often treated in women who have ovarian endometrioma. So we believe that there's some uh, interrelationship. So the problem is that there is some increase of ovarian cancer, and this is 2 to 3 fold. But not all cancers are increased. There are certain cancers who are actually less. For example, some uterine cancers of the cervix. So not all cancers are increased, but for example, thyroid cancer can be somewhat increased. So it's not all the same problem and not the same risk.
Well, important for women to know that this is something additional that they should be screened for.
Yeah.
So, the other thing that we worry about as we get older and we lose our estrogen is the increase in heart disease. Women begin to catch up to men in terms of the rate of heart disease. So, if we layer a woman with endometriosis and menopause, does the endometriosis give an additional risk factor for heart disease, or is it the same as all postmenopausal women?
Yeah, there are different effects of the endometriosis. So some problems like myocardial infarction can be increased, but the
Mhm.
function of the heart itself is actually not changed. So, in comparison to other women, for example, there is less heart failure. So, in total, women uh, don't have severe cardiovascular problems, which will cause death or death more often than others. So, the so called mortality is actually even lower in endometriosis, which is actually good news, even though there are some cardiovascular problems, but not very severe.
For many women who suffer with endometriosis throughout their reproductive lives and have pain and discomfort cyclically, and then finally enter menopause and the cyclical pain goes away, even if they're troubled by terrible hot flashes and night sweats, there's a little bit of fear about, if I put estrogen back in this, will I be back where I was before? So, what words of advice do you have for our women who have the double burden of having had endometriosis and still have endometriosis? It doesn't disappear with menopause and now are very symptomatic. Is there hope for them?
Yeah, one could use if they are symptomatic for hot flashes, for example. You can use, as I said before, estrogen plus progesterone, or even just progesterone alone if they don't have so much hot flashes. So
Right.
these women who had endometriosis before, or even have now endometriosis during postmenopause, can be treated, but always with progesterone agents.
And I think that's so important for women to understand that this is different for this group of women because we think of women without a uterus and women with a uterus as different treatment options. But in many cases, the endometriosis changes that for them. Thank you so much for joining us today and shedding important information on a very difficult subject.
Okay, thanks. It's a pleasure.